In the 14th ASEAN Health Ministers meeting in 2019 in Siem Reap, Cambodia, Indonesia has presented the theme for our chairmanship 2020-2022 entitled Advancing the Achievement of ASEAN Health Development. Through this theme, Indonesia will strengthen ASEAN health cooperation by setting course for the next 5 years policy and its work program 2021-2025. Under Indonesia's chairmanship, the ASEAN health sector has successfully developed the ASEAN Post-2015 Health Development Agenda 2021-2025 that showcases the alignment among its strategic elements, and they are vision, mission, goals, strategies, objectives, key performance targets, health priorities, and project activities. This document has considered and addressed current issues highlighting COVID-19 pandemic preparedness and response, digital health and health information system, and human resources for health. In early 2020, many if not all countries in the world, including ASEAN member states, were challenged by an unprecedented situations of the COVID-19 pandemic. In response to this, as the chair of the AHMM, Indonesia took the lead for a collective response to synergize and scale up ASEAN health mechanisms and platforms in a coherent ASEAN way, such as ASEAN Emergency Operations Center, ASEAN Plus Free Field Epidemiology Training Network, ASEAN Biodiaspora Virtual Center, ASEAN Vaccine Security and Self-Reliance, and Regional Collaborative Strategy on ASEAN Drug Security and Self-Reliance. These mechanisms and platforms enable the ASEAN health sector to address gaps and improve the ASEAN member states' health system by conducting rapid information sharing and technical exchanges, risk assessment, risk communication, contact tracing, exchange of laboratory readiness and response action, and capacity strengthening. As the health sector continues to respond according to the evolutions of the outbreaks in ASEAN, the health ministers convened a special video conference among ASEAN health ministers and with +3, and also with the United States to review current situations and also response, outline priority policy and strategic directions. ASEAN health sector is aware that global crises require global cooperation. In light of this, we enhance our engagement with external and development partners, which deliver several initiatives to strengthen current response and ensure future preparedness. In view of these considerations, we are establishing new initiatives to form ASEAN's comprehensive approach in responding to public health emergencies and other future emerging and re-emerging infectious disease threats, such as the establishment of ASEAN Center for Public Health Emergencies and Emerging Diseases, partnering with Japan. ASEAN Portal for Public Health Emergencies in collaboration with Canada and Germany. The Mitigations of Biological Threats Program, supported by Canada. ASEAN Public Health Emergency Coordination System in collaboration with the USA. ASEAN Health Protocol and ASEAN Cross-Border Contact Tracing and Rapid Outbreak Investigation Protocol, supported by the GIZ. In addition, in supporting Indonesia's chairmanship and its deliverables, technical assistance have been provided by the USA. As public health emergencies and pandemics can recur in the future, ASEAN needs to fortify the region's security against future public health threats. We also realize the importance of collaboration with other non-health sectors and partners. In view of this, we are the helm of projects and activities initiated by the non-health sectors and supported by external partners. These include COVID-19 ASEAN Response Fund and Regional Reserve of Medical Supplies for Public Health Emergencies. This initiative is to step up our response to COVID-19, particularly in filling health system gaps faced by ASEAN member states. ASEAN Travel Corridor Arrangements, a post-pandemic recovery plan to restore connectivity, prevent further economic downturns, and facilitate essential business travel among member states. To support its implementation, Indonesia developed single QR code to ease the movement of people by recognizing digital vaccine certificates and PCR results. ASEAN Strategic Framework for Public Health Emergencies that guide ASEAN cooperation in enhancing regional preparedness, detection, response, and resilience to public health emergencies. Under Indonesia's chairmanship, the ASEAN health sector has been working closely in enhancing cooperation and addressing prioritized health issues and concern in ASEAN and contributes in strengthening global health architecture, while also adapting to recent development, requiring ASEAN health sector cooperation to be flexible in its practices. ASEAN health sector will continue to move forward and become more resilient, preventive, responsive, adaptive for its next phase of regional cooperation.